All right, I'm gonna share my screen. All right, can you see the PowerPoint?
Yes.
All right,
Uh,
awesome. So
yes.
community exam one review. All right, so some basic information. The exam is going to cover the concepts from weeks 1 through 3, as well as the Healthy People 2030 concepts. So it's 50 questions, variety of different formats. It is 75 minutes for the exam, and there will be math on the exam as well. And so case study applications of concepts, assessment, prioritization, management of care. So always, remember safety first. And then what's priority, and then look at the prevention levels related to each concept and the nursing process. Talk the levels of prevention, healthy people 2030 objectives, make sure that you've reviewed those. And then, of course, understanding community-based and community-oriented nursing. And then, of course, you've had your study guide so that you can review the concepts from your study guide. So we'll
Okay.
get started. So with the introduction to community nursing. So what's the difference between community-oriented and community-based nursing?
Um, Community-oriented nursing, I would say it's like the nursing that's done in nursing, like, hold on. Oh my God.
It's okay.
Community community-based community-based nursing is, well, nursing home, and community-oriented is in the community.
Okay. All
I'm
right, yeah.
mixing
So
it up.
community-oriented nursing is oriented around the community, right? The population.
Yeah,
So
yeah,
we focus primarily with community-oriented, we focus primarily on health promotion, right? Rather
yeah,
than illness care.
yeah.
Right? Rather, in a group of people. Um, so, it's providing education, about, I don't know, vaccinations and, healthy diets, that kind of thing. Whereas community-based nursing is based in the community, right? This is illness care of individuals in the community. So that's your home health care, your hospice, the
Yeah.
school nurses, your OC health nurses, right? Good job. So again, community oriented is, focused on more health promotion within the community, and then community based, right, is more individually based. Um, so, that could, but that could even be, providing data as well. Um, Public health nursing focuses on preventative, not curative services. And so this is, usually, well individuals who have a greater need for more, preventative rather than curative services.
Yeah.
When we look at levels of prevention, so you have your primary, your tertiary, I'm sorry, your primary, your secondary, and your
Secondary and
tertiary.
tertiary.
Um, Primary is prevention.
Mm-hmm.
So preventing a problem before it occurs, right?
Mm-hmm.
So
Yeah.
also preventing illness or injury, things like that. So this could be, um, I don't know, primary would be like
Like
your vaccination.
vaccination.
I'm
Mm-hmm.
sorry?
Vaccination.
Right. That would be a
Mm-hmm.
perfect example of vaccinations, right? It could even be um, helmet or seatbelt campaigns, giving, we looked at the vulnerable populations, pamphlets for migrant workers on how to reduce their pesticide exposure, stress reduction techniques, right? Those would all be examples of primary prevention.
Mm-hmm.
Your secondary is screening, right? So
Yeah.
we do the early identification for early intervention. That helps to prevent complications. It also could potentially reverse the course. So things like your mammograms, your blood pressure screenings, pap smears, prostate exams,
Mhm.
colonoscopies, right? All of those, screening things that we can do. Because we know that the earlier we catch disease, right, sometimes the better the prognosis is. Um, and we can even go so far as, think of, people that are taking care of loved ones at home, in looking at ways to reduce caregiver strain. So like, coping strategies, and other things to help with caregivers. With tertiary, it's treatment. So that's the management of disease to reduce the symptoms, improve quality of life. So that could be medications, it can be diet, your glucose checks in your diabetics, weight loss, for patients that have diabetes, hypertension, and that kind of thing. Um, and then we go into the Healthy People 2030. So Healthy People 2030, when we look at race and ethnicity and how that affects their health status and their health outcomes, ethnic and racial minorities are more vulnerable to poor health status than the rest of the population. And one of the goals of the Healthy People 2030 is to achieve health equity, eliminate disparities, and improve the health and well-being of all groups. Another one of the goals is to reduce your firearm deaths. Gun violence is a risk factor for accidental injury or death among children. And so when we're evaluating homes that have firearms, the priority is to find out where the firearm is stored. They should be stored unloaded. The immunization or the ammunition should be stored separately in a locked device. We also need to know who has access to the gun, the purpose, what training has been obtained for the use of the firearm. But the big thing is we want to know where it has been stored, making sure that it is stored appropriately. When we, look at other parts of the, social determinants of health, they also, have an impact on people's health, well-being, and quality of life. So some of the examples of the social determinants of health are your safe housing, your transportation, the neighborhoods that we live in, right? What's the neighborhood like? Racism, discrimination, violence, their education, their job opportunities, their income levels. Do they have access to nutritious foods? And what are what's the access to physical activity opportunities, right? Is it safe for them to walk around their neighborhood? What is their quality of their air, as well as their water? And then another important part of social determinants of health is going to be language and literacy skills. So with that introduction to vulnerability, what groups are considered vulnerable populations? So these are like your poor, your homeless, your pregnant teenagers, veterans, migrant workers, and immigrants, those that have severe mental illness, are substance abusers, patients or people that have chronic sexually transmitted infections like your HIV, your hepatitis B, hepatitis C, and then those that have complex physical disabilities. Um, and when we look at the risk factors and especially poverty. Poverty is a primary cause of vulnerability. And it's a huge problem that's continued to grow here in the United States. Um, Chronic stress, not being able to pay your bills, not being able to provide for yourself, your families, right, can lead to maladaptive physical responses as well as disease. Um, what else? Um, and when we look at, you know, without interventions, the lower health status, they have increased morbidity and mortality. They have a higher prevalence of chronic diseases like hypertension, diabetes. They also have higher levels of communicable diseases like your tuberculosis or hepatitis B or sexually transmitted infections, even things like flu and COVID. Um, they also have a higher mortality rate than the general population, and that could be a combination of things. It could be their living conditions, it could be their diets, their health status, what's the crime and violence in the areas. Um, so when we look at what are some, I'm not going to go there yet. So what are some interventions that we can use for patients in or clients in those vulnerable populations? What are some interventions for patients in vulnerable populations? You don't have to answer, and then just something to think about. Communication, right? Making sure that we have that therapeutic relationship. We're using the therapeutic communication, respecting each individual as unique, and worthy of our time, our respect, our kindness, and never make assumptions. It's one of the biggest things. Let them talk to us, let them tell us their story, what's going on with them. Um, we want to, avoid assuming, that and just be open and honest. Um, Making sure that we recognize how resiliency plays, um, or how important resiliency is. The more out of control they feel, the worse their decision making becomes. And so, this we don't, this avoids, victim blaming. Lack of resiliency generally leads individuals to make decisions that will worsen their circumstances, in an attempt to escape the reality they think that they don't have any control over. So resiliency plays a big part in this. When we look at caring for caregivers of chronically ill, uh, the caregivers, when you're taking care of a family member that has a chronic illness, they're at risk for mental illness related to caregiver burnout and stress. They're also at risk of neglect and abuse of the family member. So when we look at caring for those caregivers, um, primary prevention, right? That would be, educating them on caregiver stress and burnout, teaching stress reduction techniques, encouraging a support group, as well as screening for things like anxiety, depression, neglect, abuse. Those would be your secondary prevention. When we work with the homeless population, right? Another important thing with the homeless population is creating that nice, trusting environment. That helps us to build the therapeutic relationship with the poor, the homeless clients. They may have families that they're taking care of as well, and they may not have had the most positive interaction with healthcare and the social services system. So making sure that we're really trying to establish that, therapeutic relationship. Um, and that'll help us not only to help them help themselves, right? But it'll help to create a foundation for a more comprehensive assessment of their perception of health, and then what factors that may contribute to their current health status and what we can do to assist them. We know homelessness is correlated with poor health outcomes. So the incidence of acute and chronic illness, AIDS, physical trauma is going to be significantly higher among our homeless population. They're also at, they have the disadvantage in access to healthcare services. And the healthcare service that they do receive is usually crisis oriented. It's sought in the emergency departments. Um, and then even those who do have access to healthcare may have difficulty following prescribed regimens, right? Where it comes to wound care or even medications. Um, and so a lot of the health problems within our homeless population are directly related to poor preventative healthcare services. Um, and they usually will give lower priority to that health promotion and health maintenance, right? Because their goal is to primarily to obtain food and shelter. Um, they also, as a homeless person, they do have reduced eligibility for programs like TANF, WIC, or Social Security. And a lot of that is based off the fact that they don't have a physical address to use. Um, and so when we look at the vulnerability, we can reduce it or we can reverse it by obtaining resources to increase resilience. Um, that is something that we can definitely work on. Your week two concepts, talked about the school nurse. So school nurse cares for school-aged clients. Um, they, provide, um, care for illnesses, injuries. A lot of students will rely on school nurses, for reassurance, or even hide in the school clinics, as a result of bullying, or abuse. And they may report, some of those physiological symptoms, and so the school nurse is there to assist and assess. Um, what else? Um, Home issues that affect students' performance at school, unemployment, depression within a family, um, can cause adjustment problems for kids, including impairments in their social and academic functioning. There's also we have parents, or guardian depression. It's associated with greater child emotional insecurity. So they, are more likely to experience interpersonal and social conflicts as well as school failures. We know that families play a huge part in the role in the well-being and development of their children. So when we look at school nurses and their interaction with families, it should support the goal of establishing a productive as well as a culturally sensitive rapport, that supports effective communication and collaboration. Um, and then, of course, the school nurse who is culturally competent understands that culture may include their values, their occupation, where they live, their life experiences, religion, their gender identity, their language, even their dietary and social practices, health practices. And so, that's how, we work to, as the school nurse can work to establish a rapport, build understanding, and promote collaboration. Um, so when we look at, I'm just going to stick with the school nurse. So school nurses triage a lot of complaints between stomach aches and headaches. And it's always going to be to follow the ABCs. A lot of, some kids are going to be prone to somatic complaints, that usually is a result of psychological issues, whether they're issues at home, whether it's bullying at school, or, other types of neglect or stress. And so it is important that we look at those somatic complaints, um, and understand what their psychological status is as well. Is there sexual, physical, emotional abuse at home? Are the parents fighting? Is there, what's going on at home? Um, what else? Obesity in children, we know too, has been on the rise. And so, the consequences are pretty vast. They can be lifelong, which increases their risk for cardiovascular, respiratory, kidney, menstrual, endocrine, or metabolic issues, bone and joint issues, as well as physio or psychological issues. If, kids that are obese, it also increases their risk for being bullied, which can lead to, more chronic stress. Um, and so, educating parents about obesity prevention, just it's about offering healthy food choices, following the food pyramid or using myplate.org, and, avoiding the sugary snacks. Of course, and we also want to look at, increasing exercises. But the let's see. And then, of course, poverty in kids, when we look at it that way, increases the likelihood of potential abuse, food insecurity, as well as susceptibility to infections. But developmental delays will also impact their academic progress. So growth and development. So educating our new parents about safety guidelines for infants, like don't leave a child alone in the bathtub, never leave them, on an elevated surface like a high chair or a changing table, covering the electrical outlets, keeping the wires and cords out of the reach of a child, make sure that they're using child safe sleepwear. Trying to think of what else, turning the pot handles in, right? So that they can't reach the pot handles. Um, Regular checkups are recommended at least every 2 years to assess growth and development, making sure that they get their immunizations, um, that they are, what other education, their physical activity, right? They should be physically active for at least 30 to 60 minutes a day. Um, what else? Developmental delays will affect the academic progress more severely. Trying to think of what else. Um, Talked about obesity. All right, so let's talk about some common childhood ailments. So asthma is the most chronic illness in children. It causes recurrent bronchospasm, mucus production, mucosal edema that can lead to airway restriction. It's triggered by environmental pollutants and allergens. It can also be triggered by foods, and whatever their allergies are. And then, of course, we have like the exercise-induced asthma that can be triggered by vigorous exercise or even extreme weather. So education for asthmatics, keeping a journal maybe to identify what their triggers are. We can use allergen barriers on mattresses, on pillowcases, HEPA filters. Um, in some cases too, they can get allergy testing to identify what their allergies are, making sure that we are teaching parents about how to properly use the medications, what equipment is necessary, like a spacer with an inhaler or how to use a nebulizer, making sure that we're teaching them proper administration techniques. Exercise is still important in kids that have asthma. It shouldn't be avoided. So maybe trying to find some activities that maybe be a little bit easier, like swimming. Um, Right, let's see. Smoking, smoking, around or near a child that has asthma is also potentially dangerous. So, making sure that we're educating the parents about providing a smoke-free environment, for that child, to avoid asthma exacerbations. Let's see. Lead poisoning. So what do we know about lead poisoning? So with lead exposure, the primary source of lead paint is from older buildings, those that are built or the paint that was applied prior to 1978, which lead exposure and high lead levels can lead to developmental as well as cognitive delays in our children. Um, Higher levels of lead are also associated with headaches, abdominal pain, constipation, clumsiness, agitation, which can also lead to stupor and confusion. So the big thing is to avoid the older buildings with the deteriorating paint. Um, Treatment for lead exposure includes removing the exposure. And so that could be removing the lead paint or the the lead exposure. If lead, depending on the levels of the lead levels in the child is going to determine the treatment, but we can use chelation therapy that helps to bind to the lead in the blood and to get it out. With our diabetes, so diabetes is type 1 diabetes is the autoimmune destruction of the pancreatic beta cells, leading to insulin deficiency. And so the primary treatment for type 1 diabetics is our insulin replacement and lots of parent and patient teaching, to control glucose through their insulin, through their diet, as well as exercise. And so, providing education on all of those things, depending on the age of the child, they may help to, we can teach them, sorry, to take their own blood sugars, and be involved in their own care. Adolescents and children, it's a very difficult disease. They're going to experience grief, anger, sadness. It is life altering, it's life changing. Um, they were going to have to stop to check their glucose levels, give themselves insulin injections. And so, they're going to be different from their peers, which can cause some strife in their life. Um, so they may rebel a little bit, especially as teenagers. They also, it, some of them may, look and take interest in their glucose, like I said, as well as giving themselves their insulin injections. And so, of course, based on their child or based on the child's age is how we're going to set up that education. So we can practice, on dolls or, other things, until they feel comfortable and then they can do it for themselves. One of the goals for children with our children with type 1 diabetes, is that the child will be able to measure their glucose levels. That helps them to feel a little bit more control. Um, so then we can get into scabies. So scabies is caused by a parasite. It burrows under the skin, it lays their eggs. It is spread by direct contact, person to person, or indirect contact by sharing bedding or clothing. All family members, close relatives, babysitters will need to be treated. It's treated with a topical anti-parasite cream, like something like Elamite. And then even sometimes we can do oral ivermectin. All clothing, all bedding, Stuffed animals should be washed and dried with high heat. Non-washable items, so like large stuffed animals, things like that, can be placed in a bag for up to a week. Make sure the bag is sealed. Those might usually die within a couple days. And again, all family members, close relatives, everybody requires treatment. We'll also put them on transmission-based precautions. Um, Lice, the louse lies near the base of the hair shaft. Most common symptom of lice is going to be itching. Um, and it's easily transmitted to others through sharing combs, hats, hairbrushes, or even just in close proximity, like at daycare or school. It is not related to cleanliness at all. Lice actually prefer clean hair just because it's easier for them to adhere to the hair shaft. The natural oils will actually prevent that from occurring. Um, we treat lice topically, usually 1 week apart. Um, and then they have the lice combs that they can physically remove any of the visible nits or even some of the lice. Um, Trying to think. So much like with scabies, we want to wash everything in hot water. Same thing with stuffed animals. You want to put them in a plastic bag if they can't be laundered. And they usually, for about a week, put them in a plastic bag and they usually will die in there. Um, what else? Reminding kids not to share hats, headscarves, combs, um, that will help to prevent the spread of lice. With ADHD, ADHD is characterized by inattention, distractibility, increased gross motor activity, as well as impulsivity. We can treat it with oral medications, cognitive behavioral therapy, coping skills, as well as environmental adjustments. So when we look at, kids with ADHD, they should sit at the front of the classroom, making sure we give them clear, short directions, repeating them often. You don't want to give them like a whole list of things to do. You want to give very, clear, short directions, not a whole bunch of steps. They may need reminders about taking their medication. And so like this is one thing too with our school nurses. Um, the aid kids with taking ADHD medication, sometimes it can decrease their appetite. So, school nurses can work with parents and, identify ways to make sure that they're getting their nutritional requirements. Um, and so with ADHD kids too, we want to use more power or more positive reinforcement versus negative when they are, having their behaviors. Scoliosis is an S-shaped curvature of the spine. Symptoms usually develop slowly. They're typically not painful, but things like one shoulder may be higher than the other, one scapula may be more prominent, arm to body spaces may be uneven or unequal. One arm may appear longer than the other when they're bending forward. So screening is usually done before middle school. So this is like, I remember when I was in school, we had to do this. You'd go into the school nurse and you just bend over and she would just look at your back. Um, but we can, you ask them to bend forward the waist and you're just looking for any asymmetry or any curvature within that space. We look at iron deficiency anemia. Iron deficiency anemia is more likely in our infancy and adolescence just because of growth spurts and, even with our, menstruating females. Um, the high iron foods, eggs, liver, beef, green leafy vegetables, dried fruits, beans, nuts, whole grain breads. If it's left untreated, they could develop shortness of breath or edema, which could potentially lead to heart failure. And then with the untreated iron deficiency anemia, it does tend to progress slowly. But again, it can lead to heart failure should it be left untreated. So that's why we want to educate parents about making sure that they are providing those, high iron foods, so we can get those levels up. Eczema, is another common, and I don't want to say illness, but it is another common thing that we will see in kids. Um, it's an immune-driven inflammatory condition of the skin. It's commonly associated with asthma as well as allergies. And so they'll have itching, inflammation, as well as dryness of the skin. Um, Oatmeal bath is a, emollient bath that we can use. We also can use like the non-steroidal creams, things like eczema. Things like eczema, sorry. Eucerin, Cetaphil are really good. If, they have flare-ups, they can also use things like steroidal creams that the provider can provide. But we want to provide education, right, with parents. We want them to use mild, non-perfumed soap. So like Dove is a really good one. Um, just like with, kids with asthma, we want to see if we can try to identify what the triggers are and then potentially avoid those triggers. They also can benefit sometimes from antihistamines to control the itching. But a lot of it's, lubrication of the skin, it's relieving the inflammation, preventing infection. When you're uncomfortable, that's, in itchy, right? They're not going to sleep very well. They're not going to get the necessary rest that they're getting. So we make sure that we, teach parents what to do, and then of course seek healthcare for more prescription-based medications. Um, and then we have conjunctivitis or pink eye. Conjunctivitis is an inflammation of the conjunctiva, which is the mucous membranes that line the eyelids. It can be caused by bacteria, by virus, allergens, irritants, or even toxins. Bacterial conjunctivitis is infectious. And it can spread to the other eye if we're not careful, as well as to others. So teaching hand washing is extremely important. We want them to also avoid touching the eye, even though we know it's going to itch. We don't want them to scratch at their eye. We also don't want it to spread from one eye to the other. Um, and so the treatment for conjunctivitis is usually antibiotic eye drops. In some cases, there is the erythromycin ointment that can be used as well. So we want to make sure that we are teaching parents the proper way to use those medications. They can go back to school 24 hours after starting the antibiotic eye drops. Other things that we can do is warm compresses to the eye, but those, I don't know if anybody's ever had conjunctivitis, but it itches, it burns. Sometimes there's drainage that comes from the eye and it can crust the eye. Um, so it can be very uncomfortable. And then we get into some of our more vulnerable populations. And so this is our week 3 concepts. So we have our, oops, did I skip a slide? I did. Our migrant farm workers. So some of the, when we look at migrant farm workers, we have to look at housing, we have to look at, so again, when we look with the migrant workers, um, some of the health problems that the migrant farm workers or migrant workers may be at risk for dental disease, your tuberculosis, stress, anxiety, iron deficiency, anemia. They're also with chronic, if they have chronic exposure to pesticides and chemicals that can lead to cancers. Some of the short-term signs and symptoms of pesticide exposure are things like memory loss and skin rashes, headaches. They also may have abdominal cramps and poor concentration, as well as vomiting. And then that long-term exposure to the pesticides, that, is potential, it's linked to cancer, it's Parkinson's disease, liver damage, trying to think of what else. And pregnant women that are migrant workers or exposed to pesticides as a result of their spouses, can even, it can have issues with the fetus. So it may lead to impaired fetal development in that population. Let's see. Other issues with migrant workers too is they may not have steady housing. If housing is available when they're traveling to different work sites, it may be substandard. Really just kind of depends on where they're working. They may have, campers or trailers. Some may even live in cars or tents. And so, like I said, the quality of housing may not be the best. They also may be living with large amounts of people, so crowded places, which also can lead to other health conditions like your tuberculosis, hepatitis, um, gastroenteritis, even potentially tuberculosis. So these are some things that we would need to screen within our migrant population. With our rural population, rural residents, they are rural can't even say the word rural residency. Usually this is like less than 2,000 or 200 or 20,000 residents in an area. So much more distance between things. And so some of the characteristics or health statistics within our rural residents, they tend to have higher infant and maternal morbidity rates, higher rates of diabetes, higher rates of obesity, less likely to meet their physical activity requirements. They have higher rates of suicide. Of course, they also may have, increased trauma and injuries from, whether it's farming accidents, being out in the fields, boating accidents, the ATV accidents or four-wheeler accidents. They're also less likely to seek preventative care. They're also at increased risk for things like skin cancer from sun exposure. They also may have some higher rates of respiratory complications from exposures to pesticides as well as chemicals. Some of the barriers for healthcare for them, it could be distance from services, lack of, personal as well as public transportation. They may be uninsured or underinsured and not able to pay for care. And there may be a shortage of rural hospitals or even healthcare providers. So some of the, priority needs for those rural people living in those rural areas, cancer prevention and care, mental health care, substance use prevention and education and treatment, immunizations, immunization programs, as well as family planning. So the community nurse working with our rural populations, we need to motivate the population to take advantage of primary as well as secondary services. So motivation, right? This is how people feel or how people involved feel about the problem or their health problem, whether they think the problem is serious, whether they think that the action on their part will make a difference, and whether they think they can both manage the barriers and actually perform the action. So motivation is most directly impacted positively by interventions that provide information that's relevant, as well as provided by trusted sources. What else? Then we have our homelessness. Um, So community-based nurses, right? We're going to work with homeless population. And so, you know, working with the homeless, again, it's important to establish that trusting environment. It's essential to developing that therapeutic communication or relationship. Many clients and families have been disappointed by interactions with healthcare and social systems, right? So they may be a little bit more mistrustful. So that's why that therapeutic relationship is so important. Um, what else? So with, some of the characteristics of our homeless population, right? They may be uninsured or underinsured. Adults who are unemployed, they may earn low wages. They also could be migrant workers. Increasing number of families with children is one of the largest growing segments of our homeless population. Others, people with mental illness, are veterans, people with substance use disorders, unaccompanied youth, adolescent runaways, even, survivors of violence or neglect, people with HIV and AIDS, older adults that have nowhere to go, no support system. So what are some things that we can do for our homeless? We know that homeless is correlated with poor health outcomes. Many suffer from alcohol or drug abuse and are mentally ill. Um, they are at higher risk for communicable diseases, upper respiratory disorders, tuberculosis, skin disorders, traumas, dental caries, weather-related illnesses and injuries, as well as malnutrition. And a lot of the health problems of our homeless clients are often related to poor preventative health care, right? So there's, not being able to provide for self-care. And so generally they'll give lower priority to health promotion and health maintenance, right? Because food and shelter are going, they're trying to survive. So food and shelter is going to be their priority. Homeless people have the same problems accessing care as the others in poverty, whether it's a lack of money, lack of insurance, lack of transportation. So a lot of, again, I said this earlier, a lot of their care is crisis oriented. So they'll go to the ERs, usually, right? Cost of service is higher, but generally it's not going to be refused, especially, if you go to the emergency room for assistance, they're going to get the care. And so that kind of brings us into poverty. So um, poverty rates for kids under 18 was 16.2%. And the poverty rate for people over 65 was 9.7. So those, have some poverty. The greatest impact on a child's well-being is the financial stability of the child, of the family. So kids that are from low income families. They have an increased risk for disease as well as injuries. Not having enough money, it impacts their ability to access preventative health care. Um, so working with these families to try to get them resources they need in order to, have better health outcomes for our children. So that is my PNR 208 review for exam one. If anybody has any questions, feel free to email me, and I will answer them to my best ability. Thanks. Have a great night.